Can you hear me? Can you hear me now? Okay. One of my other roles is I'm actually vice president of the American Statistical Association. And so in that role over the last year, it's been really fascinating as ASA embraces these international conversations around data science. And so it's been really exciting to be in the middle of that. Okay, so what I'm going to talk to you about today, so obviously I wear a lot of hats. So this is a relatively new hat for me, but an important one, and one that I took on for a purpose. And the purpose is sort of to advance Houston itself as a city in terms of how we can make use of data for a better city. So this is the beautiful picture of Houston. So I want you to remember that picture because the example that I'm going to present is air quality and health. And so just keep in mind that most of the time Houston looks like this, but every once in a while it doesn't. All right, so Rice launched the Kinder Institute for Urban Research. I guess maybe we're a couple of years into it. We also hired a new provost, and our new provost has connections to Michigan, and that's Marilyn Miranda. And Marilyn walks on campus a week later. She has me in her office, and she says, "I need you to do this." And I'm like, "Really? Seriously? I really don't want to do this." "Well, if I can get you $3 million, will you do this?" And so that's what happened. And so the Kinder Institute is a large effort at Rice, and it's funded, I don't know, it may have like 10 or 15 million in funding, and it's a broader effort. My role is to develop the urban data platform to support the Kinder Institute for Urban Research. But the important thing to remember is that the Kinder Institute is not only a think tank on urban research, but a think and do tank. And so we're trying to have this seamless interaction with the city and county officials in Houston and Harris County so that we have immediate translation of our research into action. All right, so this is actually a picture from my office, my second office. So this is the office that I share with the provost. This is her research office, if we share this. And so you can see it's kind of the medical center here, and then there's downtown Houston there, and I'm on the 10th floor, so I got a really good view. And so that's the 10th floor of our biological research center is where we're sitting for this Kinder Institute and Urban Data Platform. And so I'm going to say that this is real similar to what y'all been doing for decades, and so we need to not forget that. But again, we're going to be focused totally on Houston. So what is the Urban Data Platform? So the Urban Data Platform is basically a secure data repository where all the software and everything sits on that server so that you go into the system, you do your analysis, and so beautiful environment for this effort. And the key is that all of the data will be geocoded and time-stamped and cleaned and research ready. Now your access to the data will be controlled by whomever gives us the data. So we have a memorandum of understanding with the city of Houston that all of their data will come onto this platform. I'm bringing it on. We have a priority list, and we probably have maybe 200 of their data sets on the system now, and so we bring it on as the researchers need it. It's the cleaning and making it research ready, which is the really hard task. So we have a team that's curating the data and developing our clean data dictionaries. And so where this started is that we would all sort of kind of do our own efforts in this regard. And so the idea of having the data sitting there for the researchers when they have a collaboration underway is the design of this platform. let's see, what's the other piece? The other piece is that we have an education on methods related to urban analytics. Translation, I'm trying to teach Rice about spatial statistics because beyond ArcGIS and the elements within that program, they really don't have knowledge. And so we have a team of educators that are basically postdoc and students and me, and we're going through and trying to educate the community in what I think are important methods. But so I want to, so there's a really strong effort. It's easy to do the descriptive statistics piece, and we it's not only the social structure of the data, but it's the built environment. So we wanted to launch a project where we have trying to push bicycling in Houston. And Houston's not built for bicycles. We drive at 80 miles an hour, and we do it very closely to each other, and sort of bicycles don't go into that equation very well. And so how do you bring bicycles into the city? So it's not just sort of the social data, but it's also the built environment and how can we improve that. The other piece is that Houston is a city under major transition. It probably goes unnoticed here, but as we sort of double down on hydraulic fracturing in the US, the refineries in Houston and to the east of Houston are getting built up at an exponential rate. And so it's a city that literally is transforming before our eyes, and we want to be on top of that and to try to manage that, or advise in that process. So I want to, with this idea, since I'm in the methods section, I want to go beyond sort of this descriptive statistics idea of doing all of our maps for the city and understanding sort of the infrastructure of the city and the social dynamics of the city. And I want to just sort of investigate one key question, which I've been looking at for the last 5 or 6 years. So this is the link between air pollution and the health of residents in the city. So nationally, Houston is ranked near the top in terms of air quality. And if you think of basically a tropical environment, it's probably in the 80s today, I would expect. And coupled with largest refining capacity in the US, coupled with the second largest port in the US, coupled with a highly mobile society. We love our cars. There's not really public transportation to speak of. So you bring all of that together, and air pollution is one of our challenges that we have to manage. And so, when I was young, I used to try to fight that. But now, listen to me, it's one of those challenges we have to manage. So now I'm managing, I'm not fighting. And so I'm probably making a little bit more success with the managing than with the fighting. So we're going to look at air quality and acute health events, not chronic, but acute. Okay, just a reminder that statisticians have been working at this for a long, long time. So this is a JASA paper from 1973, an analysis of the association between US mortality and air pollution. Yeah, so this is why you love sitting there at your computer with Google Scholar, and you should just look up these old papers, it's wonderful. So they looked at total infant disease specific across 117 standard metropolitan statistical areas. And look at this, multivariate regression is utilized to control for some of the important factors. Okay, so anyway, we have this, statisticians have been looking at this issue for decades, and then we have seen improvements. We've seen the Clean Air Act as a result of some of this. Hopefully we'll still retain the Clean Air Act. All right, so here are a few health statements that I have up on my website. And so I'm going to say that the increased risk of an asthma attack is 10% for a single day and 13% for 3-day-long exposures when the ozone levels are between 50 to 70 parts per billion. And if we move to higher levels of ozone, between 70 to 90, anybody have a concept of high levels of ozone? We'd like for it to stay below 60, but there are days in Houston where we get up to 120, 130. They're rare, but they do happen. But it's really this sort of mid-range between 70 and 90 where we really need to be highly concerned. So the risk increased to 21% for 1-day exposure, and if there's 3 days of high ozone, then the risk of an asthma attack goes up to 45%. So these are things that we can manage. Then the other piece of this is, so asthma we can manage because we know how to keep ourselves from having an asthma exasperation. But cardiac arrest, it's a little bit more problematic. And so using, I'm not going to say big data techniques, I'm going to say complex data techniques. We were able to show that if there's a 20 parts per billion increase in ozone within a 3-hour period, 3-hour window, then there's a 4% increase in risk of a cardiac arrest. And then the impact will be greatest when the ozone levels are above 75 parts per billion. So it's that rapid increase in ambient ozone that we feel like we picked up on. So those statements, so some of these statements have gone international in terms of finding the link between ambient ozone and cardiac arrest. This work has been scrutinized heavily by the state of Texas because they would like for us to think that everything's wonderful in our very rich city of Houston. It is very rich, a lot of high-level industry, and we all benefit from that. So it's come under a lot of attack, gets a lot of news media. Anytime there's an air crisis alert, the reporters go to my website and sort of pull off these statements. And these statements have been polished. They're not statements that a statistician would really make. And they're really not quite polished enough, but that was as far as I was willing to go in terms of their polish. Okay, and so are we doing okay so far? Okay, all right. So what statistical thinking supports these conclusions? And so again, we focus both on asthma and cardiac arrest, but just to describe the story, I'm going to focus on cardiac arrest today. Okay, all right, so out-of-hospital cardiac arrest. So that's a cardiac arrest that happens like here, your home, or anywhere but a hospital. And why do we care? Well, we care because approximately 300,000 people in the US experience a cardiac arrest, and 90% of them won't make it. So we care. You want a defibrillator next to you. You want someone that understands bystander CPR next to you. And so that is our challenge. Can we address this? And so our goal was if we could improve our local understanding, we could save lives. And I think we actually have. I think it's actually, okay, so first of all, I'm a strong believer that correlation doesn't imply causation, what we teach everybody at when they're 6 years old, right? So there has to be some link between ambient ozone and a cardiac arrest, and so this is the link. I'm not going to embarrass myself by trying to read it. That's why you have co-authors, right? So the chief co-author on this work, so David Peirce is the head of EMS, and he's the leading medical physician for the city of Houston. And then my other co-author is Lauren Ron, who is part-time research faculty member at Rice and then head of special projects for the City of Houston Health Department as her other part. So that's Ron, Ensor, and Peirce, and we have a series of publications on this. But there's your pathophysiological link, and so it does exist. And so if we do find something, there's some science to support that it should happen. So this is my cardiac arrest slide. So Houston EMS responds to a resident of Houston about every 3 minutes. And So the data that I'm going to use are 11,677 cardiac arrests in Houston, and so that's from 2004 to 2011. And so that's basically every EMS call for a cardiac arrest in that time. I have the location of where EMS responded and the time. So I have space and time information. All right, so where's my bias? Is there bias in this data? Yeah, there is bias in this data. Okay, for cardiac arrest, I think we're probably all going to call EMS. When we go to asthma, if you're having an asthma attack, who's going to call EMS for an asthma attack? It's your most vulnerable population. You know, if my daughter has asthma, she has an asthma attack, she's in the car, I'm at the hospital in 2 minutes. You know, so the people who don't have resources to manage this themselves. I think for a cardiac arrest, we're probably none of us that brave. We're probably, calling EMS immediately. But that is, we have to consider, again, from Bob's remarks this morning, we have to consider our sampling frame. And my sampling frame is the 911 calls to the city of Houston. Okay, you probably, unless you're an air quality environmental statistician, you probably don't know much about this, but there are a network of monitoring stations across the US that record hourly measurements, and they've been doing this since 1970. And so in Houston, we have about 44 of these monitoring locations that are controlled by the government. There's another 30 or so that are privately controlled. I've had that data before, but I don't have it anymore, and they won't give it to me any longer. But okay, but that's going to form the information to understand the level of pollution. Okay, and so here I'm using ambient levels as a proxy for human exposure. You have a problem with that? I have a problem with that. And so in some previous work, we actually put badges on kids and did the indoor-outdoor, and there's lots of work like that, but that's not this study. And so the question is, can we pick up anything with this ambient exposure? And then if there's time, I'll give you a simulated solution to that problem at the end. All right, so here's roughly the data. And so this is the city of Houston, and Rice University sits about right here. This is the ship channel. This is all petrochemical plants in here. So all your major petrochemical plants just go down toward I-10. New Orleans is over here. And so these larger circles are my monitors, air quality monitors, and these dots are every cardiac arrest in that 8-year period. So that is my raw information that I'm going to try to, my raw data that I'm going to try to turn into information and information to action. If I look at it in a different way, so I'm going to take every hour of ozone levels over that, I guess I grabbed a 5-year period. So the gray is the average ozone level for the city of Houston. So that's 5 times 8,760 hours. And then the blue is where the cardiac arrest occurs. Okay, so do you think there's some association? Yeah, we might say yes, but again, maybe if you knew a lot about ozone is high, so when there's sunlight, and so we could also just be having more cardiac arrest in the day than at night. Okay, so that's another question. All right, so I'm going to basically link these 2 data sets in point in space, point in time, and that's the statistical methodology. So I've just this is a cartoon picture, but it just shows the type of linkage that we can do. And with all of these data sets that we put into the Urban Data Platform, everything is geocoded. Everything that can be geocoded is geocoded so that you can do this cross-linking by location. All right, so here's my cartoon of the analysis that I'm going to go through. And what should I finish? What time should I? 5 at 2 or trying to? Okay. 5 to 7 more minutes. 5 to 7 more minutes. Okay. Okay, so I won't go through this in detail, but the pieces are, first I have to build my, my map of air quality from those point locations that are observed every hour for 40 years. And so that's one piece. So I have, using all of this information that has the air quality measurements, I have weather, I have land use and streets. I can build this up as rich as I want to. It becomes more complex, of course, when I do. But all of those will feed into some air quality estimate at a point in time and point in space. I would also have uncertainty in that estimate should I choose to use it. And then the question is how am I going to link that to the EMS calls? And again, the data that we have are cardiac arrest and asthma. And so what is that question mark? So first of all, on the air quality, so roughly 438 million data points. These are expensive data points. These continuous air quality monitors are very expensive. And so we'd really like to be able to make use of that. We see that we can. There's strong affinity across space in these locations, which tells me that some type of spatial interpolation should work really well. There is also strong temporal correlation, which is represented by this axis here. So these are the 1 hour lagged values at each location. And so there's a lot of correlation in the system that I would like to model and take into account. And so it's roughly a spatial temporal Gaussian process fit to transform pollution, where I'm incorporating both meteorology and land use. So that's sort of the area of statistics in which we do this. I will say that if you're doing air quality modeling on the short term, short time scale, then I really do like these hybrid statistical models that fuse like the CAMX model or the CMAC model with your data observations, and there's some good statistical work in that area. So we actually do pretty well. And so our cross-validation mean absolute percentage error is 3%, which is much better than anything else that I've seen. Okay, and so I'm going to, but the key is that these estimates are computationally instantaneous. So if I'm going to try to link this with my air quality on health, then I have 3 different strategies that I want to try. My daily count regression, which is a quasi-Poisson count model of daily counts. And then I have a case crossover plus conditional logistic regression, which takes into the count the location in space and time. And then the gold standard would be a log Gaussian Cox process, which we just really haven't been able to get that to computationally go at the level of the amount of data that we have. So let me just skip to the case crossover, which is really what we've published. And so in this case, the subjects serve as their own controls. And so I manufacture controls around the event. And if we go to an example of this data, so you see these first case, this is where the cardiac arrest occurred. And then I look in that month at the same time of day and same day of week, and I grab the ambient ozone levels for that location. And so I'm comparing 15.9 parts per billion when the event occurred with 13.5, 1.7, and 1.7. And that comparison is done through a conditional logistic regression. Okay, and so the conclusion is, so here is our odds ratio for this, and then we can segment the data as we want to. So again, that's what we published, and that's where we're going. What I'm working on now with some students is to build up this more point pattern process approach, which I think is really the better statistical way to go. The reason that we're doing that is because we're going to be integrating multiple pollutants, and the conditional logistic regression just can't handle too much more. Okay. All right, so let me take 30 seconds for this one last slide, just to let you think a little bit broader about things. So, you know, I told you I was not happy with ambient air pollution levels as a proxy for exposure. But I don't have the resources to go out and measure indoor versus outdoor exposure. And so what I did is I partnered with Sally Keller's group at Virginia Tech. And so they basically have an agent-based model for every city in the US. And so they can simulate the population of 4 million people moving around the city. And so we did that. And this simulated model is informed by the demographics of the city at the neighborhood level. And so then we just watch how people move around, and we look at their exposure, and we're working on adding quality of housing into this equation. And so we do see this differential exposure. And again, this is sort of a new effort, but I did want to bring it to your attention. Okay, so let me go to the and do part, and then I'll close out. So for cardiac arrest, we worked with the American Heart Association and showed them where to target their training in bystander CPR. We also worked with the head of EMS to properly staff and coordinate the ambulance response. And we haven't measured it, but I feel pretty confident that we've improved the response time as well as the bystander CPR. We have measured the cost, so I could get at this. For the asthma, we've been a little bit more aggressive, and so we actually send alerts on high action days to the city and school officials, and so they go into action to try to help their patients deal with these days that are a little bit more problematic. And with that, I'll close and say thank you and remind you how beautiful Rice is. Okay, thank you.
You have people that want to go from start to A to end or start B to end, and this dotted row doesn't exist originally. When it doesn't exist and you do the basic analysis, you find there's an equilibrium which delivers about a solution.